Hello, you hear me? Hello, and thank you for watching the presentation regarding Mounjaro or tirzepatide. The mechanism of action for Mounjaro is first of all is a single peptide that activates GIP and GLP-1 receptors. That's how it works. So those receptors are important because they control increased insulin secretion from pancreatic beta cells. They also increase insulin sensitivity of the cells. And another action of these receptors and the incretin peptides is to reduce glucagon levels in the blood. Also, the effect is slowing of gastric emptying, so the patient feels full and they have less appetite, therefore they would eat less, and that would contribute to weight loss in terms of this medication. Indication for Mounjaro right now is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. So the limitation of use, it should not be used in patients with a history of pancreatitis, and also not indicated for use in patients with type 1 diabetes. The dosing for Mounjaro starts with 2.5 milligram once a week for first month. Then if more glycemic control is needed, you can up the dose to 5 milligram once weekly in the second month, and gradual monthly increase from 7.5 to 10 to 12.5 to 15 milligram once weekly for the ultimate increase is indicated. These are several pens, samples, the way they look like. As you can see, these are 5, 10, and 15 milligram pens. For storage, it has to be refrigerated. The pen that is used for single pen can be stored in room temperature, but make sure the temperature is not more than 86 degrees. Do not freeze Mounjaro, and if it's frozen, do not use. And it's recommended to keep it in original container to protect it from light. Some adverse effect, it can cause risk of thyroid C-cell tumor, hypoglycemia with concomitant use of insulin, secretagogue. It's hard to say that, but anyhow, like drugs such as glipizide, glyburide, drugs that promote insulin secretion, that's what it means. And also pancreatitis is an adverse effect, diabetic retinopathy complications, so this is a big issue. Make sure the patient let the health provider know about any kind of changes in the vision. And potential for kidney damage is potential risk of dehydration. You have to make sure patient knows the signs and symptoms of renal impairment, and hydration is important, but one of the adverse effects that can occur is acute kidney injury, so that's important to talk to your patient. Advise patient to read FDA approved patient labeling, medication guide, and instruction for use. Finally, pregnancy. You have to see the benefit versus risk. If the benefit outweigh risk of the Mounjaro in pregnancy, then you can use it, but overall is not recommended in pregnant women. Also, regarding contraception, use of Mounjaro may reduce efficacy of oral hormonal contraceptives, so advise patients using oral hormonal contraceptives to switch to a non-oral contraceptive methods, or add a barrier method of contraception for 4 weeks after initiation and for 4 weeks after each dose escalation of Mounjaro. So it's important to use a second barrier to prevent pregnancy. Again, thank you for watching this brief review of Mounjaro. Please share and like so we can cover other medication of this class and also other diabetic medications. Thank you.